cryovision became a tool to make evaluation for the follow-up after any kind of treatment. In Italy, there are only 3-4 companies who produce orthotic. We do that. We do many things more.
Hi, it's Phil and Fred. Welcome to Modern Footprint, the podcast that is rethinking podiatry and shaping its future.
Hello, everybody. Today we have a very special podcast. We're going to go across the ocean to Italy to meet Frederick, that flew there, and to meet Dr. Vittorio Molinari, Podologa, Italia, a podiatrist from over there. Hello, guys.
Hey, Phil, how are you? So glad to be
I'm
with
very
you.
good.
Super. It's such a great pleasure to be here with you. For us, it's 7 o'clock at night. We just had a great day of clinic work, saw patients, and spending time with Vittorio, who's our partner over there. We're in Sestri Levante, close to Genoa, Italia, and Liguri. And it's a great pleasure to be here. And we'll be discussing today about podiatry, how podiatry is in Italy. And Vittorio is going to tell us a little bit about the way he was introduced to us and what's the future in Italy about podiatry. So Vittorio, thanks for being with us.
Hi, everybody. I feel thanks for having me
Hi.
on this special podcast. And I'm very happy because
It's our pleasure to.
I think
It's our pleasure to be overseas.
For sure. No. I think if we are here is because we made something different and something great in those years. So thank you very much for believing in Italia, in Progetto Postura.
So Vito, tell us first of all a little bit about you, about your where you're coming from. The way your studies and everything. What's podiatry like? How do you become podologo in Italy?
Okay. Well, when I finished my high school, I tried to do the test for physiotherapy, but I didn't get it. So for the second choice, I choose the podiatry career. So we can't call podiatry because we didn't have any class about the surgery, so we are not allowed to complete the formation in that way. But I decided to introduce me in the podologo school because I would like to work with the soccer players. So for sure they use the feet, and I succeeded with that because I worked with the first league in Italy, Serie A, with Genoa. But at the end, I decided it wasn't my future career. No. Well, the school in Italy is the university is with the 3 years studying, and we have different university in the north center of Italy, are almost 6. And I study in Genoa, where close where I live. And after that, I decided to fly to Barcelona to continue my career in posturology. So I lived there for 4 years in doing a master for those 4 years. And then I continued with the osteopathy school. And I almost finished there in Italy before COVID. So, by the way, in all those years, I continued to study kinesiology, posturology, updating. So the treatment, the rehabilitation always has been important for me in my daily work. And till when arrived the COVID time. So this changed everything. Yeah. And it was, I think, a stop for many things, many stuff, many experience. But for me, was a new start, a new beginning, because I had the opportunity to meet Frederick and for a project that we had in common with another company in the north of Italy. And I met him for the first time in September 2020, if I'm...
Okay. 2020, yeah.
2020, and it was funny because I woke up very early in the morning at 5 to drive to Brescia. It's a 3 hour from my house, and had a call with Frederick, and it was 5 in the morning in Quebec. So we spent for once a week for 3 4 months till Christmas time, all the Wednesday together in the morning, because I should be the manager of cryovision and cryoscanner in that clinic. But at the end of the year, the project didn't accept to go to bet.
Yeah,
With the
what was
system.
interesting is that at that point, remember, Phil, we were like, we're trying. We always thought that Europe and whatever France, or Italy would be a great fit for us for the scanner, and this is how Vittorio and the other company when they discovered that we had a new scanner, a new way to do things, and remember, we talked a lot about it, Philip and I, and with our John, our partner, and even with Nick, saying, all right, we need to find the right people, the right person to work with. And then, we started to have those little weekly chat every Wednesday morning. And all right, what's new? What do you do? And asking questions. And then by Christmas, like you said, when we realized that it wasn't going to work with other company, we said, hey, Vittorio, why don't you just do it yourself?
Yeah, in the same year, I met again my partners. We are 4 person, 4 podiatry in Progetto Postura, is a podologic company, and I study with them in the same 3 years in the university. So we always have been friends together, but we decided to start something new in 2019 because we understood that the concept of podiatry and the product with the orthotics were not enough and update at that moment where we lived. So we decided to found something together to mix the force, no?
Yeah.
To make something better. And the same time, I started with Frederick. So when Frederick and Cryos allowed to stay with the and keep the technology and not resend to Canada, I talk with my friends and say, if we have to start something new, we don't have to choose the common technology that we have in Italy or in Europe, so treadmill and something else. So we decided to start with a new technology that no people had never seen before. So it was new
But
for everyone.
Yeah.
but the funny thing, it was COVID, so we couldn't meet in person. So we talked a long time. When the first time we talked was like 2020, but when, Frederick, did you go there for the first time?
I went there, it took 2020. So I went there for the first time in 2022.
Two.
Yeah, May 2022. So
Wow.
almost 2 years. So we all joke about that. When I get off the train station and Vittorio look at me and say, you really exist. You're real. It's not just a joke. I say, hey, it's me. But yeah, so
Yeah, for 3 years, he was my postcard friend.
yeah, that's it. Huh? Write a letter and let's do some. But yeah, no, that was really fun. But what's interesting, I
Yes.
think, and Philip, I think we talked about it, and all people listeners that if you go back to our first podcast we did with our story, we're a lover of biomechanics. We love what we do, and we like to work with people that want to do things even more and better and bring new way to treat patient, because we all do that in the end to help patient. And I think that's with Vittorio with Progetto Postura and his partners, Matteo, Alessandro, Gabriele, the 4 of them, and the new collaborators do. And this is what we really like. And that was a great discover for us to be able to be there with them. And and we see it growing. And we talk about it back home, but we see it growing the way you guys are doing it and doing differently that we're doing it, Philip and I. And that's nice because we keep learning, and that's
Yeah.
what neat on both sides.
It was a very
And Vittorio,
yeah.
Progetto Postura is a clinic or is many clinic, but it's something else too.
I think Progetto
You do
Postura
training with.
Progetto Postura is more than was born. I mean, it at the beginning was a laboratory, okay, and then a little clinic, and then a clinic for more podiatry, and then a laboratory for more podiatry colleague, and now is something more. It's a concept that we use to inform the people. We do a lot of communication for any information for passion, for companies, for safety work, for sport, for master classes. And we use our name as a pioneer of something that in Italy is not exist right now because in Italy there are only 3, 4 companies who produce orthotics, but we do that, but we do many things more with the colleague, with the conference, with the meeting. So it's a startup. I think the right name is startup, and we are very happy because thanks to you, we can see something more that we can find in Italy. Because if we have the pioneer, we are 30 years back from you.
Yeah.
So no, I mean, step by step is what we find, and the university is not prepared to to push us to become a businessman. Okay, just only podiatry in our own clinic on different clinics. So the jump was that to invest into technology, invest to something more, invest to our formation to become something for other podiatry. So those 3 days that we are spending together is a matching with the different kind of podiatry, all the young, and
the older one, and
Frederick as professor. So it's nice.
no,
It's really a small school to discover new things.
Yeah.
Well, congratulations, Vittorio. That's very nice.
And what's nice is that it's a great way. I think we're seeing the evolution of podiatry. What's the future of it? And there's many ways you can go, but what we can see from what those guys are doing and the collaborators is that there's a way where it's how can we make our patient better and doing step by step. And this is what's really interesting. You know, the approach is a little bit different, but we all have the same mindset in what we want to do. So, and you know, even for them, you know, we were talking about what we're learning in school, Philip and I, when we were, you know, back in the US, and we're saying it's still the same thing that's being taught. And it's the same thing I think that's being taught still, even in Italy, they don't do. And you know, the question is, you know, Vittorio, you know, what do you think the first time you saw dynamic orthotics, you know, orthotics that supposed to promote movement and not block it?
Then I will be very clear. We didn't study anything about the biomechanics in our university because the classes were very poor. So depends in which university you study. In Milano are more focused to biomechanical platform, and we study more diabetic foot, and surgery after surgery in Pisa are totally different. So depends where you study. You grew up with your focus. So finishing the university in Genoa, I needed to learn more, and I found it only in that at that time, and I love it to fly to go and visit Barcelona, and with the posturology I found my concept to understand the body, no, but the body in different way that you study. And coming back, I didn't find any interesting courses about biomechanical. So still now, when I'm with Frederick and we talk about the passion, how they move, the concept are different because my knowledge is different than yours. So I can speak very well about rehabilitation, muscle disease, nervous, but how they walk always is interesting to to share the knowledge because I can understand more and more and confirm what I feel on the bed, no,
Yeah. And
with the test.
and what's good in your case, I think it, and in if we do a quick history, the podiatry school, if we really talk about podiatry the way Philip and I know it, is in the US, and we have one in Quebec in Trois-Rivières, and then we have there's in Australia, and then there's one actually in Barcelona. And in Barcelona, and this is where you went, you did your master over there. We had the chance to meet you. You made me meet some of the professors over there. They do, they're really like us, DPM, Doctor Podiatric Medicine, but everybody has their own way to do stuff, and it's nice to see how we put all that together and we can make some evolution and treatment, and what you're seeing, what I'm seeing, what Philip's saying, we're saying it. How can we can all put this together, and being able to do it is great. Yeah.
We always wanted to know more about everything. I mean, Frederick and I just want to know more technology, but more way to think, more way to view our patient, like you do, Victorio. So it's very nice to work with you too. So
And seeing, and now maybe you can give us a little bit of explanation. A nice thing about it, and show Philippe, and when you came to visit us, you were talking with us about it. Tell us a little bit how you use the crowd vision. The crowd vision, which is where we take our images and we use it mostly. Philippe and I are follow up. We say it's great, but use it even more proactive, putting patient in different position. Look at them, squatting and doing different. If you remember the one with the playing trumpet, and you took a picture, of that musician, and saying, "All right, let's do a treatment and let's do a picture."
Well, for sure, you have to think about that. I was by myself and with my partner without any training in the year about the technology.
Yeah.
So, yeah, 3 hours by call with Frederick is just not enough to understand how you work, how you live your podiatry. So it was a tool for me. So I had to play, to understand, to be wrong also. But at the base with Progetto Postura, we follow a very special protocol that we mix around after many years, and this is a mix of tests by osteopathy, posturology, kinesiology. So the aim of this protocol is to understand how is the activation of the muscles in this moment when we meet the patient. So understand if the patient is ready to accept a treatment, podologic treatment. Why? Because every time we try to put an orthotic, and the concept of orthotic we will talk about later, but sometimes the patient came back with any disease, so we had to make a different modification to the conventional orthotic. So we started to be strictly to understand if the patient need at that moment the orthotic. So the protocol is an investigation of the muscles of the back and the legs. And when cryovision arrived in the clinic, we I started with the patient, with the partner, if the color that we see in the cryovision imaging could be matched with the test.
Yeah.
So we understood after months that what we did for a long time, pushing the legs and the force of the patient for the resist to the stimulation, when the muscle was off, so not activated, the red color was the protagonist, and the green was normal force, and the blue high force to resist. So it was very nice because finally we could demonstrate and show to the patient that all the uh, mm, magician test at the bed was with a fundamental meaning. Okay, so the patient understood what we were doing,
Yeah,
and accept the condition at that time. Start with us with a therapy. So after that, the cryovision became a tool to make evaluation for the follow-up after any kind of treatment, not only orthotics, not only physiotherapy, but also reeducation, nutritional reeducation, or changing sport. So we live the movement in different way, not in biomechanical analysis, but in changing of the life of the patients. So it was the base to focus our Progetto Postura business, where the people understand that when they are with us in our house, in the clinic, they are glad to understand how is the posture, and it's not only the test, not only the words, but it's an imaging that it's clear.
It brings you some objective reviews of what you're doing. So this is what you do, and this is what we always wanted to do with our technology. Let's try to have some objective findings so you can say, we all have our own little magic when you treat patient, whoever you are, think the certain thing. But that's nice when you can do it and prove it. And what you're doing now, I think this is what it does. And you brought your own protocol in that crowd vision, knowing that working with the color because you had your same setup to do. And I saw it again today, and we could see the evolution, and you could see the without the orthotics, with the test you're doing, and it just once again, having sometimes you look, at one picture and somebody sees something, the other person look at the same picture is going to see more than that, and this is what you guys are doing, and I think that just proved that we can keep evolving, and there's no ending to that.
Yeah.
If you keep searching, you can push it even more.
In fact, the first experience.
Once the patients see the picture, then they believe, and your treatment is going right. So that make a big change in the way you treat patient. They agree with you. They know that it's doing what you said it's doing.
Yeah, you know what? Something more, that when we started with the clinic, with the Progetto Postura in Genoa, was a new clinic. Okay, nobody works in Genoa where we work, so it was a new beginning.
Yeah.
So we needed to communicate it to the people that we had something new that could help their well-being. Okay, and we started to work with the physiotherapy clinics, rehabilitation, and doctor of the posture and movement. So we start to receive patient with the back pain, head pain, different pain instead of foot pain. Okay, even if we are podiatry, and we start to send the pictures of the cryovision to all the colleagues that send the patient. So next Saturday we are going to make an update course for those colleagues that they are not podiatry, but they love to receive imaging about the patient and how they improve with our rehabilitation or their rehabilitation. So this was great, and this is why we decided to change your protocol and do many semi-dynamic position of the posture in the with the camera in the cryovision room. So the squat, simulating the kicking for the soccer player, or the volleyball posture, or the
Yeah.
piano. On the I brought a friend with the sax, with the violin. So we tasted everything to show them what's happening in their back, in their legs, when they are working, when they are playing. So the they understood very well, and for sure the communication to the friends, to the other people, makes Progetto Postura more important for the consciousness of the people in general. So it was great, something new, something very interesting to show to the population. Well, I'm very happy about that.
Well,
And the
congratulations to invent something new.
Yeah, and the wellness, I think it helped the wellness and the well-being of patient being more active, and it's not just whatever the day-to-day worker, day-to-day musician, or whatever. How you can help them. We were talking before, we were talking in the past about kids, about this is a great way to do it, and that I think in the future is going to help us to keep evolving in what we do and keep evolving maybe in the orthotics, the insoles that we make, the type of orthotics, because you're coming from like many of us when we studied conventional rigid orthotics. And I remember I said, all right, Vittorio, remember showing you that on the camera. This is what we're using. And, we're doing that every day in our clinics and we see results. And you're like, okay. And instead of, once again, because you're open minded, which is great. You said, let's go, let's do
Yeah.
it. And then you look. And so how did you find that transition about more conventional orthotics, going a little bit to dynamic orthotics, being able to explain it to patient?
Oof. I think the most important is my knowledge about the posturology, where they say that less is better. So less material that we use and less material that it damage by the time makes the body better. So when Frederick introduced me the orthotic, I say, why not?
Yeah.
Why not? Because I didn't have any long experience with classical and conventional orthotics, because it was a very huge gap for podiatry in Italy. But we needed something different, because I always believe that the treatment, if we use all day long, could be very important for the
Yeah.
person, like the nutritional re-education, like training.
Yeah.
But if you sell orthotic therapy to the patient, and with the conventional, and he can use only for 6 hours, or with the specific shoes, and not for all day long or in different situation, you are giving a good information, but then it stop
Yeah.
for a long time. So this is an
Yeah.
imbalance of information is not good for the body. Sometimes it's worst. So when I understood that the cryosortotic could be put inside of all the shoes, all kind of shoes, without taking off the original
Yeah.
insoles, it was great. It was great because we help more people.
Yeah.
More people are becoming our patient, because the lawyers, receptionists, secretary, people who needed to use for the work elegant shoes, short shoes, sport shoes, very difficult, where the conventional topic could not enter there.
Yeah, and I remember I told you, I said, Vittorio, we're in the country of Italian shoes. Italian shoes,
Mm.
how can you wear it if you have to put those humongous orthotics in there and they don't wear it? So you're losing all the benefit of it. So
Yeah.
why don't? And I understood why, like we understood why in the past, that if you don't have the right tool, the right orthotics, the right treatment, it won't work. And I said, now maybe you can have, a solution to helping those
Yeah.
people in Italy, and how can they be able to wear the nice fancy shoes and being able to walk with it. And you're like, oh wow, this is I remember it was great.
How did your patient react to having a very different orthotic that they used to, Victoria?
Well, they were very surprised because they could believe that one little piece of plastic could be a very very original therapy, no? But when I start to make my communication to the patient, because for sure Frederick had touched me the point of the property of the orthotic, but the the training to sell to the patient why this is important for them. This is day by day. So sometimes I propose as this is very hygienic. So you can dirty, but you can clean very quickly.
Yeah,
So you don't have a, bad smell
yeah,
after the sport. So every patient need the right characteristic for understand it's great. So like with a woman, you can wear this when you are in sport, when you work with elegant shoes,
yeah,
when you go to dinner. So the people understood that the cryos have the right property for their life. And other is they understood that in Italy we used to change the conventional orthotic every year. Why?
yeah,
Because it
Wow.
damaged after the time, like the wheels, no? And I understood that when I saw many patients with the old orthotics after 1 year or 2 year, I discovered some dysfunction very different important in the new body,
yeah.
in the new posture. So I said, it's my fault or is changing something. And when I saw maybe a little hole in the conventional orthotic
Mm,
or not the good lift in the heel or something different, I understood that the material is very important. It need to be the same shape, the same
yeah,
thickness. And when you lose that, you are putting the posture in dangerous. Okay,
Yeah.
so this is how I explain to the patient. I say I need to be sure that your life is always day by day safe.
yeah.
Even if you fly and go to Ireland and London, and we will not see for a long time, I know that after 3 years, your talk is still the same, is still okay. This is important.
And I think this is really what we want, knowing that we have an orthotics that can last, but also I think it brings back. It's always the same thing. It brings back to the same that you're making the right evaluation, you're making the right exam, you've got objective findings, you're able to show and to prove to your patient, this is what I'm doing, this is how you look, and patient understands. So you start from the day one working with them, and when patient works with you, it makes a big difference because now they have confidence, they understand why, and when you understand, you know why you should do this exercise. Because once again, and we mentioned it before, orthotics is a treatment. So if you approach it as a treatment,
Yeah.
just not one treatment, is different. And I think that's nice to see that one ocean away, you got people that have the same mindset and that want to do the same, and just doing it. And I think there's so much more to do, but I think we're right there. We are a right step, a right start, a nice start.
Patients are always amazed, like you said, Vittorio. They have that small piece of plastic and say, "Well, that's going to change me," and they believe you, but hesitate a bit. But then again, you see them later on, show them how the posture change, and they realize that yeah, it's working. And I always compare to glasses and contact lenses. I
Yeah.
mean, your contact lenses is very small, but it's still doing the job.
Uh,
So great.
So what do you
Very good
think,
at explaining.
Vittorio? You, like you said, you guys, the startup Progetto Postura is there, going through, through the walls and making their way to the next step. What's the next step you think in Italy for podology and future of orthotics, future of evaluation of posture. How do you see that in 5, 10 years from now?
I think the future started, I think, this year, because for the first 3 years we decide to understand how we can communicate to the people what we are doing and what we can replicate around us. So when we were invited from one of the most important congress in Florence by gynecology and proctology for
Hmm.
muscles of the pelvis disease, the doctor called me and say, "You have a good tool. Please prepare me exposition about your photo of the posture." And when I explain about the work around the pelvis, and I show them how the muscles activation of the pelvis change with orthotic and without, they the doctor say, "Okay, guys, we understood that we did only a little piece of the work for the
Yeah.
rehabilitation of the pelvis." So it was shaking. Okay, and after 1 month, we went to Tuscany in Viareggio for the second huge congress of podiatry. Think about Philip, that in Italy the podiatry became official with the register since 3 4 years ago. Before, only association,
Wow.
private association. So
Okay.
the future started 4 years ago with the register, and they invite us at the list, because one appointment of
Yeah.
exposition was not confirmed, and they ask to explain about activation in the sport runner athletes. So when I show the imaging about what we do every day, all around this 500 podiatry in the room, in the hall, say, "Wow, what is that?" And I started the exposition saying, "This is what we do usually since 4 years ago." So it was ultra shaking.
Yeah, for sure. Something new, huh?
Something
Yeah.
new. And I talked only about the cryovision, not orthotics. But the after the exposition, I went to my seat, and the president of the congress say, "Please, can we talk about that for next step together?"
Okay.
And this is why Frederick is here, because we invited different old podiatry who works in the association and in the register, and they want to understand why something new arrived in Italy without any information
Yeah.
to the podiatry. So we will
Yeah.
show what is our daily works, and we want to help them to involve, to increase their knowledge, because we need more information about the future. And the
Yeah.
future, for sure, is the technology. The future is continue to apply our information and formation, thanks to technology like the scanner and the cryovision. But I think we start to turn, and with the young podiatry want to make it better. We,
Okay.
we we met different podiatry who went like me to study in Barcelona. So every time more people want to learn outside from our country, it means that the mind is open.
Yeah.
And if
Yeah.
the mind
Yeah.
is open, when arrives something new, we can have a match, we can have a meeting, and we can discuss without any problem. And the door is not more closed,
No.
is just open. So we are pioneer to understand how to communicate, how to invite, advise, and help ourselves,
Yeah.
for sure, because we are still
Yeah.
learning,
Yeah.
and this
Yeah.
is
And
thing to do.
help our patient.
And for sure, always the same
Mm.
patient, happy patient,
Yeah, happy life, happy
Happy life.
passion. But we're not. This is great, and I think we say, and we believe in the work you guys are doing, and we love to see how you the evolution of it, and it's great. I think it's just for us, seeing that it's a great way to see that first what we did has a meaning to it, and that sometimes you believe in something and you say, are we the only one? But when you see people from outside and they come in and they not just believe, but they bring new idea. This is what you guys are doing, and we try, and even ourselves, we try to incorporate that in what we do every day. It's nice, and thanks. It's great. I think that
Yeah,
we we're really happy, and hopefully, maybe next time we'll be, even Phil will be with us here in Italy, and
all,
to be
all
able,
together. Yeah,
yeah, that'd be nice. So
all right.
I think that's it. We're to kind of conclude, Phil, with
Yeah.
the little
Well,
word.
thank you very much, Vittorio, to share your passion, to share your knowledge with us, and we'll continue working with other professional that you show the technology and the new way of doing things. So thank you very much. So I guess it's a bit later for you as compared to Quebec. So, but I think you already started some
So yeah, we'll have
drink.
a little cheer. Thank you. It's aperitivo right
Yeah.
now, and thanks again. And
Same to you.
we'll see you soon, everybody. Thanks again for being there. All right,
Thank
ciao.
you. Thank you very much
All
to
right. Take
all of
care.
you.
Bye, everybody.
Bye bye.